Hello. So if you're going to try to lose weight, should you have blood work checked to begin with? Well, that depends. Are you looking for cosmetic weight loss or are you looking for medical weight loss? My name is Dr. A and I've been specializing in medical weight loss since 2009. And we recently had a new patient who wanted to transfer for our office for care. And she was from a different state. And when she came in for her consult and it was discussed with her the need for labs, she said, no way. She had no intention to get her blood work done. Is that wise? Well, if you recognize that obesity is a medical condition, then it makes sense that you want to have medical things done to treat it and monitor for it. So, obesity is a medical condition best managed by a healthcare professional who is licensed, such as a physician or a physician assistant or nurse practitioner. And in medical weight loss, one of the reasons why we check labs is to look for complications of obesity. So obesity leads to things like type 2 diabetes, high blood pressure, high cholesterol, and a lot of those things can really only be detected through blood work. And so when we check blood work and we see that someone has type 2 diabetes, we're going to treat that with their medical weight loss. If we see that they have high blood pressure, we're going to treat that as we help them lose weight. If they have something like high cholesterol, we're also going to treat that as we help them lose weight. And if you realize that by losing just 5 to 10% of your total weight, that's likely going to produce health benefits, such as reducing the risk of type 2 diabetes and high blood pressure and high cholesterol and certain kind of cancers, because there are so many medical complications, but we diagnose these by getting the blood work. In addition, we want to check blood work when someone is losing weight to make sure that they're losing weight safely and to check for shifts in electrolytes. So a very common electrolyte that changes with weight loss is potassium. And if the potassium is too high or too low, that can cause things like cardiac dysrhythmias, which is not good for you. So again, the only way we can detect the potassium is through blood work. Looking at someone's not going to tell us, and that's why I personally like to check labs after about 10 to 15 pound weight loss, because that's when we're going to see the shifts in those electrolytes. In addition, it's important to check labs to look for things on the inside, hormonally, that could be related to obesity. For instance, it's not uncommon for me to see patients who have thyroid abnormalities. Either they don't have enough thyroid hormone or the thyroid hormone just doesn't work very well. But again, looking at them on first glance, I can't determine that. I had a patient I saw just today who had her labs done and she's having her thyroid managed outside, but there are some things that I saw that could be tweaked a little bit that could also be playing a role in her weight. Other hormones that we can check are testosterone and estrogen. I tell my patients all the time that as we get older, our metabolism decreases. And as we hit menopause and andropause, our metabolism decreases. Well, guess what happens when we hit menopause and andropause? The testosterone and estrogen start to go down. So no wonder that as we get older, it can be more challenging to lose weight because our hormones start to go down. So it's important to check the labs because looking at someone is not going to tell you what their hormones are doing. Cortisol is another hormone that we can check with blood work. Normally with that, I check it with saliva because it can fluctuate throughout the day, and a blood spot test of just a snapshot is not going to be very helpful. But I do recommend doing cortisol salivary testing to see if that's very, very high throughout the day or very, very low, because that can also play a role in weight. But again, looking at someone is not going to tell me these things. It requires doing blood work. And so that's a very important part of medical weight loss. Now, again, if you're doing cosmetic weight loss, they don't have the ability to draw and order labs because it's not a medical professional. But that's when the difference is between medical weight loss and non-medical weight loss. So to conclude, my name's Dr. A, and I've been specializing in medical weight loss since 2009. And if you or someone you know is looking to lose weight, we would be so happy to partner with you. It's very important that we check labs when we see new patients because we want to make sure there are no medical complications of obesity, and if there are, for us to be able to do something about them. We want to make sure that as you lose weight, that you're losing weight safely and that your potassium's not doing funny things to cause a dysrhythmia, because that's not very good for you. And we also want to check labs to make sure there's no hormonal reason that you're having your weight, such as thyroid or testosterone or estrogen, or maybe even cortisol, as those can all contribute to weight gain. So again, we are taking new patients. So if that is something that you're looking to do, please give us a call at 614-442-2600 or visit us online at www.prohealthservices.org. We're here in Central Ohio. We offer telemedicine visits. And so be sure to like, subscribe, and to share this message as we're trying to help fight the obesity epidemic in America. Bye for now.